Most heart attacks don't happen randomly. They happen in a window, a specific predictable window that researchers have been studying for decades. And that window, the first 2 hours after you wake up. I'm Dr. Eleanor Hayes, an internal medicine physician, and after 20 years of treating patients just like you, I can tell you this: what you do in the morning matters more to your heart than almost any other time of day. Not because mornings are dangerous, but because your body goes through a dramatic biological shift the moment you open your eyes. And if you don't understand that shift, you could be making simple mistakes that put unnecessary strain on your heart every single day. Here's the framework I want you to hold on to throughout this video. I call it the surge and support window. When you wake up, your body surges, blood pressure rises, stress hormones spike, your heart rate climbs, your blood becomes slightly more prone to clotting. All of this is completely normal. Your body is preparing you to face the day. The problem? If you add extra stress to a body that is already surging, you're stacking risk on top of risk. Today, I'm going to walk you through 5 common morning mistakes that many adults over 60 are making without realizing it that may be pushing that surge into dangerous territory. And I'll tell you exactly what to do instead. Stay with me because number 4 surprises almost every patient I share it with. Mistake number 1, jumping out of bed too fast. Let me ask you something. When your alarm goes off, what do? Most people sit up immediately, swing their legs over, stand up, and head straight to the bathroom. Seems harmless, right? Here's what your body is actually experiencing in that moment. When you've been lying flat for 7 or 8 hours, your cardiovascular system has settled into a resting state, your blood has pooled, your heart rate is low, your blood pressure is at its overnight baseline. The moment you stand up, your heart has to rapidly redistribute blood against gravity. It has to push blood up to your brain, your muscles, your organs, all at once. For a younger heart with flexible, elastic blood vessels, this adjustment is almost instant. But after 60, blood vessels become less elastic. The adjustment takes longer, and in that gap, your brain and heart may briefly receive less blood flow than they need. This is called orthostatic hypotension, a temporary drop in blood pressure upon standing. Research suggests it becomes significantly more common after age 60, and it's been associated in multiple studies with an increased risk of cardiovascular events, including falls, fainting, and in vulnerable individuals, cardiac stress. What I tell my patients is simple. Pause before you rise. Sit up slowly. Sit on the edge of the bed for 30 to 60 seconds. Let your body adjust. Let your blood pressure stabilize. Then stand. That one small pause respects your body's surge and support window. You're supporting the surge instead of amplifying it. Mistake number 2. Skipping water first thing in the morning. Here's something most doctors don't have time to explain in a 10-minute appointment. You wake up every morning in a mildly dehydrated state. Think about it. You've gone 7, 8, sometimes 9 hours without drinking anything. You've been breathing, sweating slightly. Your kidneys have been working. Your body has been using fluid all night. And when you're mildly dehydrated, your blood becomes thicker, more viscous, harder to pump. Now combine that with the natural morning surge in blood pressure and clotting tendency, and you can see how dehydration quietly adds to the load your heart is already managing. Research in cardiovascular health consistently shows that adequate hydration plays a role in maintaining healthy blood viscosity and supporting normal circulation. I've had patients in their 60s and 70s who were diligent about everything, their medications, their diet, their exercise, but they were starting every morning with coffee on an empty, dehydrated stomach. Coffee, as we'll talk about in a moment, is a mild diuretic. It can actually pull more fluid out before you've replaced what you lost overnight. The habit I recommend: before coffee, before breakfast, before anything, drink 1 full glass of water, room temperature, slowly. It's simple, it costs nothing. And it's one of the most consistent recommendations I make to patients who want to protect their hearts. Mistake number 3, intense exercise immediately after waking now. I want to be very careful here because exercise is one of the best things you can do for your heart at any age. I am not telling you to stop exercising in the morning. But there's a difference between morning movement and immediately intense morning exercise. Here's the concern. During the early morning hours, typically between 6 a.m. and noon, The body's natural surge is already raising blood pressure, increasing heart rate, and making blood slightly more prone to forming clots. Multiple large studies, including research published in major cardiology journals, have found that cardiovascular events like heart attacks occur at statistically higher rates during these morning hours. When you add high intensity exercise to that already elevated biological state, without warming up, without hydrating, often without eating, you're asking your heart to go from zero to maximum effort during the exact window it's already under the most natural physiological stress. I've seen this pattern in my practice. Someone who is otherwise healthy, perhaps slightly overweight, jumps into a vigorous morning workout without preparing, and they feel fine until one day they don't. I'm not trying to frighten you. I'm trying to empower you with information. If you exercise in the morning, and I hope you do, give yourself a 10 to 15-minute warm up. Walk gently. Stretch. Let your heart rate climb gradually before you push it. Hydrate first. Let your body move through the surge naturally before you add to it. Mistake number 4, the way you're drinking your morning coffee. Here it is. The one that surprises almost every patient I mention it to. It's not that coffee is bad for your heart. In fact, research suggests that moderate coffee consumption, 1 to 3 cups a day, may have neutral to even mildly beneficial cardiovascular effects for many adults. The problem isn't the coffee. It's the timing and context of how most people over 60 are drinking it. Mistake number 1, drinking it on a completely empty, dehydrated stomach. We just covered why that matters. Mistake number 2, drinking it while rushing and stressed. Caffeine stimulates the release of adrenaline. Adrenaline raises blood pressure and heart rate. When you're already in the morning surge window, already slightly dehydrated, and you add caffeine plus psychological stress, you are stacking multiple triggers at the same time. Mistake number 3, and this one is particularly relevant for anyone on blood pressure medication, drinking coffee before taking your morning medications. Research suggests caffeine can temporarily blunt the effectiveness of certain antihypertensive medications in the short term. What I suggest to my patients is this: drink your water first. Take your medications as prescribed by your physician. Eat something small, then enjoy your coffee, slowly, seated, without rushing. Same some coffee. Completely different impact on your heart. Mistake number 5. Ignoring the emotional weather of your morning. I saved this one for near the end because it's the one that gets the least attention. In my clinical experience, it may matter the most. How do you feel in the first 30 minutes after waking up? Are you anxious? Already running through your to-do list? Dreading something? Checking your phone and absorbing bad news before your feet have touched the floor? I ask my patients this question, and most of them pause, because nobody has ever asked them that before. Here's the science. The morning cortisol spike. Cortisol is your primary stress hormone, peaks naturally in the first 30 to 45 minutes after waking. This is part of the normal surge and support window. It gives you energy. It helps you get going. Layer psychological stress on top of an already elevated cortisol level, you amplify the cardiovascular response. Blood pressure climbs higher, heart rate stays elevated longer, inflammation markers rise. Research in psychocardiology, the study of how emotional health affects the heart, has consistently shown that chronic morning stress, emotional reactivity, and anxiety are associated with higher cardiovascular risk over time. I'm not asking you to become a monk. I'm not telling you to ignore your responsibilities. I'm asking you to protect the first 15 minutes of your morning. No news, no phone, no emails, just water. Quiet. A few slow breaths. That small boundary, that 15-minute buffer, is one of the most heart protective habits I know, and it costs you absolutely nothing. Before I wrap up, I want to give you something practical to take to your next appointment. Here are 3 questions worth asking your own physician. Is my blood pressure being checked at the right time, and does my morning reading concern you? Given my current medications, is there anything about my morning routine I should adjust? Are there any signs I should watch for in the morning that would warrant calling your office? These are not alarming questions. They are smart, proactive questions, and any good doctor will be glad you asked them. Your mornings don't have to be a source of risk. They can be a source of protection. Understanding the surge and support window means working with your body's natural rhythm, not against it. Pause before you rise. Hydrate before you caffeinate. Warm up before you push. Create a little quiet before the world gets loud. Small habits, consistent mornings, a healthier heart, that's the goal. And it's absolutely within your reach at any age. If this video helped you, please subscribe. Every week, I share research-backed health insights designed specifically for adults who want to age well, information you simply won't get in a 10-minute doctor's visit. And if you found today's information valuable, share it with someone you care about. Because sometimes the most important thing we can give someone is a piece of information that changes a daily habit. I'm Dr. Eleanor Hayes. Take good care of your heart. It's been taking care of you your whole life. This video is for educational purposes only and does not replace the advice of your personal physician. Always consult your doctor before making changes to your health routine or medications.